When is the best time of year to get a flu shot?
The influenza vaccine, for the most part, is only effective for about 24 weeks.
Is Wyoming ready for the coming tidal wave of baby boomers with Alzheimer's disease?
The strain on family caregivers as well as our professional caregivers is tremendous from Alzheimer's disease, and it will continue to increase.
And when human trafficking involves children?
What traffickers will do is they'll go to poor families and they'll talk to the parent and they'll say, hey, like your daughter, like she's so pretty, she could be a model. Or if they're not in school, they say, you know, we could help pay for her education. All she would have to do is come work in a factory.
Good evening. Welcome to this edition of Wyoming Signatures. I'm your host, Mary Jung. If you've been in a drugstore the last couple of months, you've probably noticed advertising to get your flu shot today. And some pharmacies, such as CVS, gave store discounts to customers vaccinated in August. Some experts say ignore these marketing ploys and wait until October or later. Otherwise, some people, particularly the elderly, may not be protected when they need it most. Our Rachel Wagner got more information from Associate Professor of Nursing Anne-Marie Hart.
What are your overall thoughts on this early marketing?
Well, I actually have kind of mixed opinions on this. On the one hand, we know that as many people who can get the influenza vaccine as possible is a really good thing, both for themselves, but also for other people in the community who may be at risk for influenza. You may have heard about the herd effect, whereby it not only helps the individual ward off influenza, but may help other individuals who are at higher risk for complications of influenza, like someone who's older or someone who has a severe chronic illness. But on the other hand, there is the potential that the vaccination won't last the entire influenza season. So that's kind of the downside to it as well, too.
Okay, so that kind of leads to my next question. If
Sure.
a person does get it early, say in August, how does that decrease the effectiveness of the vaccine?
So a couple of things. We know that usually people are pretty well vaccinated within about 2 weeks of receiving the vaccine. So these individuals are right on tap for an early influenza season. However, most of the times, and I actually spoke to the outgoing Wyoming Department of Health epidemiologist, Dr. Tracy Murphy, last week, and he said that typically Wyoming has their first influenza cases in December and occasionally in November, but usually the earliest that we will see influenza is in December. However, it can go as late as March or April. And the influenza vaccine, for the most part, is only effective for about 24 weeks. Now, it can last longer than that. However, we do know that the effectiveness starts to wane after 24 weeks. And some people would even argue that it's even earlier than 24 weeks.
Okay, so it's my understanding that some people, particularly older people, if they get vaccinated too early, they won't have the immunization when they need it. Is that true?
It's possibly true. So the 24 weeks that I talked about before, which is roughly about a 6-month period, maybe a little less than 6 months, is the time that we expect the influenza vaccination to be effective in individuals who have a robust immune system, a very healthy immune system. However, some older individuals, their immune system isn't going to work as well, and so the effectiveness may be reduced in those individuals. So it is possible that in older individuals that it would not last the entire 24 weeks.
So then when do you recommend that people get flu shots?
So it's always kind of a stab in the dark. We never know
Yeah.
for certain when the influenza season is going to hit us. We know that it's typically going to be sometime between September and March. Again, typically in Wyoming, it's going to hit around December or so. But many people would encourage people to wait between October and November. So do it between October and November would be ideal. Having said that, it's never too late to get one, and so it would be effective even if someone were to get one in January, February, or March, because we do sometimes see influenza even in the spring months as well too, even into April.
Okay, so is it ever too early to get one?
So that kind of that's an interesting question. So if the individual is going to be traveling, especially to somewhere in the southern hemisphere, because their influenza season is kind of the reverse of ours, so it's going to be during their winter months, which are our spring and summer months. Or if the individual is visiting somewhere near the equator, they don't actually have peaks in their influenza activity like we do in in the extremes of the hemispheres. So, in those cases, we might actually recommend that people would get an influenza vaccine outside of the normal October, November. Aside from that, it's probably best to get the influenza vaccine in October or November. But having said that, if someone just knows that they're not going to get the influenza vaccine because they're going to be maybe traveling when it's going to be available in their community, or they're going to be snowbound, or something that's going to limit their ability to go in and get the vaccine, then it's probably okay to get it earlier, but it's not as ideal. Again, thinking about that 24-week period and knowing that influenza in Wyoming and Northern Hemisphere can go through April.
So if somebody gets it really early, can they get it a second time to provide extra immunity?
We typically do not see that. However, studies have shown that people can get an influenza vaccine as long as 4 weeks have gone by. If we're doing it any earlier than that, then that could actually interfere with the immunity from the first vaccine. Okay. So you definitely want to wait at least 4 weeks before getting a second one. And studies are ongoing as to trying to figure out one that will last a lot longer than 6 months. Mm-hmm. But of course, the complications with that are currently the influenza vaccine is based upon the influenza strains that are going around the world. And so what goes into an influenza vaccine every year changes. And so every year the influenza vaccine that you see is going to be probably a little bit different from the ones you've had in the past. Some of it may be the same, but some of it's going to be different.
In the past, they've offered the nasal spray vaccine. Mm-hmm. This year, they're not doing that. How do you think that will affect the number of people that get the vaccine?
So fortunately, the nasal vaccination was only indicated in children up and then to adults up to age 50. And we know that the higher risk individuals for influenza are primarily older adults, 65 and older. So I do anticipate that not having the nasal vaccine available will certainly reduce the number of children and maybe even some younger adults who are getting the vaccination. At the same time, we do know that those individuals who are at highest risk will probably continue to get the influenza vaccination, the shot. So, and it's interesting because the intranasal vaccine has been very, very effective. It's actually a live strain of influenza, unlike the shots, which are inactivated. They contain dead virus, but the intranasal contains a live virus. However, for the last couple of years, they found that the intranasal version has not been as effective. Typically, when they first created it, it was actually more effective, but in the last few years, it's been less effective for some reason.
Okay.
Yeah.
Well, thank you so much for being with us, Anne-Marie.
You're welcome. Thank you for inviting me.
As baby boomers age, cases of Alzheimer's disease are expected to make their largest percentage of increase in the West and Southwest. In Wyoming, this means if we look at conservative estimates by the American Alzheimer's Association, that the number of people with this type of dementia will be between 13 and 15,000 by the year 2025. The impact on our state's healthcare system and reliance on Medicaid will be tremendous, and also on families and caregivers, as our Patrick Wolfinbarger found out from Catherine Carrico of the Wyoming Center on Aging.
Catherine, thank you for being with us today. Can you tell us about the Wyoming Center on Aging?
Sure. The Wyoming Center on Aging is a newer entity here on campus at UW, and our mission is to really optimize the health and wellness of Wyoming's older adults as well as their caregivers. And we do that a few ways. We support aging research here on campus and trying to increase collaboration among faculty and encourage those folks to really go after funding and to beef up our aging research here at UW. We also support clinical training in geriatric settings throughout the state. We also support education. We have a number of different education opportunities for healthcare professionals as well as the public that occur around the state as well as online. And then we also have some services that we offer to older adults and their caregivers.
As the population grows older, one of the main concerns is Alzheimer's.
Right.
And concerns about the cost of care,
Right.
the growing numbers. Can you tell us a little bit about the situation in Wyoming? What is Alzheimer's?
Right. So you're right. This is a really important concern right now that we're facing as a nation and as a state. Wyoming is actually one of the states that is projected to age the most in the coming years. And with Alzheimer's disease specifically, we anticipate about 114% increase in Alzheimer's disease and the number of cases of Alzheimer's disease in Wyoming by 2025. So we're talking very short term when we think about how things are going to change for our aging population in Wyoming. So it's a significant problem that we face as a nation, that we face as a state. When we talk about Alzheimer's disease, we're talking about one type of dementia. So there are multiple types of dementia, Alzheimer's disease being the most common, accounts for 60 to 80% of all dementia cases. There's other kinds of dementia, including a vascular dementia, when someone has an event in the brain that then impacts their cognition. So that can be a stroke, something along those lines. There's also frontotemporal dementia, another kind of dementia that affects the front part of the brain, and Lewy body dementia. Those aren't as common. The one that we really think of the most is Alzheimer's disease. So the way you can think, a way for people to think about this, it's just like there's multiple types of flowers, there's multiple forms of dementia or types of dementia.
So when someone's diagnosed with Alzheimer's, is that a short-term, long-term diagnosis? I mean,
Right.
People think of it as a terminal condition. Is that the case?
Yeah, that is the case. So Alzheimer's disease is a progressive disease that is fatal. So Alzheimer's disease is one that once you have it, you're going to have it for life, and eventually, it does lead to death in people.
That puts a tremendous strain, I can imagine, on healthcare facilities, on geriatric care, on families. What is the Wyoming Center on Aging? How does it involved in helping those areas deal with Alzheimer's?
Right. So Alzheimer's disease education and training is one of our biggest focal areas. We have 4 focal areas, and that's one of them. And we have multiple projects that we do, because you're right, the strain on family caregivers as well as our professional caregivers is tremendous from Alzheimer's disease, and it will continue to increase as we see more older adults who are diagnosed with Alzheimer's disease. So we have training efforts for healthcare professionals. Those include things like our online dementia care certificate, which is a completely online program that has an advanced and a beginner level. And that's a free program that we offer. We've had about 1,000 people complete that certificate program, and they have said that it's really been useful for the way that they're able to care for older adults with dementia. We also do education events in local communities around the state. Our next one actually is coming up here in Laramie at the end of October, and that's going to be, we have a morning that's designed for the public where we'll give some more general information about Alzheimer's disease. And then we have an afternoon for healthcare professionals as well as legal professionals, where we're going to really talk about the legal process and the implications of helping people get their orders, their affairs in order with Alzheimer's disease.
So that'll be something that you'll be doing around the state?
Right, yeah. We have had these events in communities like Sheridan. We've done them in Riverton, Cheyenne, and so it's something that, a show that we take on the road to take some of our really knowledgeable dementia experts in the state to local communities to talk to their healthcare professionals as well as to the public. We also have a significant event coming up in June. It's going to be the second Rocky Mountain Alzheimer's Summit. We did this event in 2014, which featured national experts in Alzheimer's disease, a lot of really prominent researchers and leaders in the field who we bring to Wyoming. We had over 200 people attend that event. We're going to be doing that again in 2017, and we're really looking forward this time to focusing on how we can improve the care of people with Alzheimer's disease today. What do we know that we can do to help improve their well-being as well as their caregivers' well-being? Because as you mentioned, those caregivers carry a large burden.
As somebody who may be concerned about Alzheimer personally, or a family member who's concerned about another family member who they think may have Alzheimer's or dementia, what kind of symptoms should they be on the lookout for that then they should go to their family doctor for testing?
Right. So the most common early symptom is not being able to remember newly learned information. So, for example, making an appointment and not being able to remember when that was. So that's often the thing, that people just can't remember things that they used to be able to on their own and without assistance. But all of a sudden they can't remember those things. Sometimes people will also notice that they're not able to balance a checkbook the way that they used to be able to. So what we're really talking about with Alzheimer's disease is symptoms that are over and above what we see in normal aging. So as someone ages, it's natural to not be able to recall a name of someone that you haven't seen for a little while. It's slower to remember some of that information. But that ability that loss of the ability to encode new information is really what should be of concern to folks, and something to bring up with a healthcare professional. But Alzheimer's disease really affects how our cognition in a lot of ways, and so if someone has concerns, I would encourage them to go to alz.org and learn about the 10 signs, which talks about the broader symptoms of early Alzheimer's disease, and to talk to their healthcare professional, because early diagnosis really is very important.
Well, thank you so much for being with us today.
Absolutely. Thank you for having me.
Human trafficking is a form of modern-day slavery in which people are illegally traded for commercial gain or exploitation. The United Nations Office of Drugs and Crime reports that sexual exploitation accounts for nearly 80% of cases, and at any given time, millions of people are victims. Our next guest knows something about when children are involved. Tyler Schwab is the founder and CEO of an organization helping to prevent children in the Dominican Republic from falling into this terrible fate, as well as rescue and heal others not so fortunate. How do you explain to people what this is?
Human trafficking is the movement of persons for exploitation, whether that be forced labor, forced begging, or sexual exploitation. You know, a lot of people think that slavery ended with Abraham Lincoln, and it didn't. There are more slaves today than there ever was in the time of Abraham Lincoln. There's 27 million people enslaved today in slavery, and 2 million of those being children. And those kids, they're often exploited for sexual purposes. So when people ask what modern day slavery is, I point them to human trafficking and say human trafficking is modern day slavery.
And what does your organization, Gifts of Grace, have to do with this?
Gifts of Grace, what we do is we seek to prevent child sex trafficking in the Dominican Republic. The Dominican Republic, it's been called by some experts the Walmart of child sex trafficking, because people can go down to the Dominican Republic in a weekend, engage in their evil behavior, and then come back for work on Monday like it was no big deal. And it's a fairly cheap flight to the Dominican Republic compared to other places. And so my organization, Gifts of Grace, what we seek to do is prevent child sex trafficking. And a lot of the times what traffickers will do is they'll go to poor families and they'll talk to the parent and they'll say, hey, like your daughter, like she's so pretty, she could be a model. Or if they're not in school, they say, we could help pay for her education. All she would have to do is come work in a factory or something like that. So the parents, wanting a better life for their children, send their children with these traffickers, and that education, that promise of these great blessings, they never happen. And what they do is they're sold in brothels, on the streets, to pedophiles seeking to engage in that behavior. So what we do is we seek to prevent that from happening. We promote awareness among the low-income communities in the Dominican Republic, and kids that aren't in school are the prime targets for traffickers, because there's that promise of, let me take your kid and let me get them in school, let me get them into a nice school, get them an education and give them a better life than what you have. And the parents wanting that will send their children with them. So my organization, we help pay for their school, we help pay for their tuition, their school supplies. For children that have been rescued from this evil, we help pay for their tuition so they can go back to school. And so this experience that they've passed through doesn't define who they are, but their future is bright through education. And so basically that's what we do, is we just try to combat the root causes of what causes these families to give their kids to these traffickers, and hopefully we can prevent that from happening.
Prevention through higher aspirations and opportunity.
Exactly.
Where did you get this idea?
Well, I lived in the Dominican Republic for 2 years. I was a missionary for my church there. And, when I was there, my eyes were very, opened to what poverty really looked like. I thought poverty was something entirely different. But when you see somebody living out of a box, a cardboard box, you know what poverty is. And so one day, I saw this dad, and he was beating his daughter. I assume it was his daughter, and she was wearing something along the lines of a pillowcase, something like you'd see in Harry Potter with the house elf in that story. And she was taking him food, and she had just got done mopping the floor, and she tripped and fell. So this man grabbed her by the hair and struck her with a whip across the face. And so me and another person that was with me kind of stepped in between there and tried to stop that from happening. But I walked away with that experience, just with a realization of what actually goes on in that country as far as exploitation of children. And that night, we were headed back to the apartment where we lived, and I saw this 9-year-old girl, and she was dressed like a prostitute. She was wearing clothes that weren't meant for a 9-year-old girl. And she was hanging out with this old man. He had to have been in his 50s or 60s, and he was American. And I didn't understand what human trafficking was at that time. So I see the situation, and it seems off. But I didn't think anything of it. I think I may have thought that girl needs to put on some clothes, and I went my way. And it wasn't until I was back in the United States and I heard someone talk about human trafficking where it clicked, that what I had witnessed that night was a young girl being exploited by an older man, and so it led me to study of human trafficking and just how rampant it is in the Dominican Republic. And when I realized how those people, I spent so much time with them, that they have a hold on my heart and have a special place in my heart, and I love them and I want the best for them, and I always knew I wanted to help them. And when I found out what was going on with the kids and the exploitation that goes on, I couldn't just sit by and do nothing. So that's how Gifts of Grace was started. We were started 2 years ago, and to this point, we've helped over 75 children get into school, have their school supplies bought, their tuition paid, and we hope to continue along this process and hopefully help a lot more kids in the Dominican Republic, and then take this model and spread it worldwide so that kids aren't trafficked as easy by those people looking to exploit them. And we want to bring, a big thing with us is just awareness. And here in Wyoming, I don't know if we're as aware of human trafficking as we should be. Just in the Cheyenne area, you look in the last 3 or 4 months, the Frontier Rodeo, that big rodeo happened. I'm not a big rodeo person, but I heard it's a big rodeo. But 15 people were arrested there for trying to buy sex from an underage girl. So it's happening in Cheyenne. Just, I think, a month ago, a man with the largest collection of child pornography in the whole United States was arrested in Cheyenne. And it's those people that are addicted to child pornography, that are the ones that will pay to go overseas and engage in sexual activity with a child. So, if you don't think human trafficking is happening right here in Wyoming, you're wrong, because it is happening here in Wyoming. There's people that are out looking to purchase children for sex, and as a community, just as a nation, I don't know if we're as aware as we could be. So a lot of my work here in Wyoming, as well as growing the organization, is just raising awareness in this area, in this state, and hopefully kind of setting an example or following the example of some states who have taken a fight against this organization to say, you know, Wyoming, we fight for our kids. You know, this slavery is not okay. We support organizations that seek to fight this slavery, and in Wyoming, child sex slavery is not okay with us.
You have an event coming up to raise money as well as increase awareness. Tell us about that.
Yes, so one of our partner organizations, they're known as Operation Underground Railroad, and what they will do is they'll put on a hidden camera and they'll go pretend to be sex tourists, people that go and look to engage in sexual activity with children. And they'll work with local law enforcement and kind of set up like a sting, and law enforcement comes in, everybody's arrested, the traffickers are arrested, and the kids are saved. And that organization put out a film called The Abolitionists. The Abolitionists follows this organization on hidden camera as they go to Colombia and Haiti and rescue kids from sex trafficking. And along with watching their missions, they also, you know, provide information on what sex trafficking is, the numbers, how to recognize it, and it's just a great awareness documentary as a whole, and it's up for an Oscar. So if you get a chance, check them out because they're up for an Oscar. And so Gifts of Grace is hosting that showing November 2nd at 7:30 p.m. at the Carmike Frontier Theater in the Cheyenne Mall. It's a big event for us. You can go to our website, Gifts of Grace, WY/abolitionist, and buy your tickets. It's a big event for us. It's fundraising, but even, I mean, it's big for us because we get some donations from it. But even if we didn't get any money from it, it's still a big event just for the state of Wyoming, just to become more aware of what people are doing to fight this evil, and just so people know what this evil is. Because 2 years ago, if you would have asked me if you would have asked me and told me that people travel overseas to engage with sex and children, and they pay for sex with children here in the United States, I wouldn't have believed you. That kind of evil was just so unfathomable to me that I wouldn't have believed you even if you would have told me. But it's real, it's happening, and this event as a whole is a great event for people to become more aware on Gifts of Grace, obviously, but just the cause of human trafficking and child sex trafficking as a whole.
Tyler, thanks for sharing your concerns with us today.
Yeah, my pleasure. Thank you for having me on the show.
And we've come to the end of our show for tonight. Until next time, I'm Mary Young, wishing you happy trails for everyone here at UWTV. We leave you now with Fall Wildlife Photography by Beverly Schrader. Have a great night.